everyone, my name is Brooke and I have Crohn's disease, and in this video I am going to talk about what medicine I have been taking for the past 12 years to help keep my Crohn's disease in remission. And please note, this is a disclaimer: talk to your doctors before taking this medicine. I am not telling you to take this medicine. If you're looking for a new medicine because your current medicine is not working, this could be something you could talk to your doctor about. They will know better than I do. So like every drug, there is two different names for this medicine, and this is a pill medicine. I take a pill every day for it. If you are more into the IV medicine route, this video is not for you. So the two names are either mercaptan is what my pediatric GI called it, or 6-MP, and that is what my adult GI calls this medicine. So this next part is going to sound really scary, but 6-MP is actually a chemotherapy drug. People who have leukemia also could take this medicine. However, it is a treatable route for Crohn's disease and ulcerative colitis. And I have been on this since 2011. And yes, there are side effects for some people. So far, I have had very minimal side effects. So the big side effect of this drug is that it is immunosuppressive, so you can get sick quite easily, and you can be sick for longer periods of time. It takes a lot longer to get rid of the common cold than it would an average person. Other side effects that I have found by taking this medicine is pale skin. I do not tan, I burn, so that's also a little bit of genetics, but I have found as the years go on, I have pretty pale skin no matter what I do. So it's recommended to stay out of tanning beds, of course, anyways, or out of the sun, because some people can have a reaction with the sun with this medicine. I have not. I just am pale. And then also bruising quite easily. I bruise quite often, even just a little bump and a bruise will form. So those are the two other side effects that I have had on this medicine. Though with this medicine, it can have long-term effects on your kidney and liver. So for instance, I don't drink alcohol because I know it won't mix well with this medicine, and I just don't want to add any more stress onto those two organs. So that is a sacrifice I was willing to make. So just keep that in mind. And then I have my list of other side effects. So I'm gonna read them all off and I'll let you know if I've ever gotten them. Just because I have not had these side effects doesn't mean someone else hasn't. So diarrhea is a common, it says a side effect. However, I have Crohn's disease, so I lean that more up to Crohn's instead of from this pill. Hair loss. I have not had any hair loss. I have quite thick hair, so I have not had that reaction to it. Vomiting, no. Sore throat, only when I'm sick. Some people have just being weak and tired. I leave that more up to having Crohn's than anything. Some people can have like fevers or chills or skin rash or itching, hives, swelling of the face, lips, and tongue. I have had none of that. So like I said, this is a hit or miss with everyone, obviously. It is a pill I take every day. I only have to, depends on your weight and is how much it's really gonna affect how much you have to take. I personally do not like the IV drugs, so I'm really happy that I work so well with the mercaptan or 6-MP pill, because it saved my life. I went through a couple phases as a teenager not wanting to take medicine, and it sent me right into a flare-up. And then the moment I got back on this medicine, give it a couple months mixed with steroids, I was back into remission, you know? So it's changed my life. It's made me as normal as possible. So that's why I'm sharing it with others. It is a generic drug, so you won't see commercials about them. I asked my GI doctor, because I always see the commercials for Humira and all these others, and I was like, why don't I ever see one for 6-MP? And he said, because it's a generic drug. So it's actually cheaper, which is good for most people, because American health system is, don't get me started on that subject. It's just so bad. So the medicine I take is 6-MP or mercaptan, and I hope that if you are looking for new medicine, that this helps you out, and thanks for watching.